Hey everyone, welcome to this episode of Compassion and Courage Conversations in Healthcare. This is the podcast where I teach compassionate communication, provide perspective, and inspire resilience. I want to thank everyone who has shared and commented and rated and reviewed the podcast. That all helps us get the numbers up. Thank you for helping get the word out and for passing along information that you find valuable as well. Today, I am super excited that I get to interview Dr. Tony Orsini. Dr. Orsini, welcome to the show.
Thank you, Marcus. It's just so great to be here. I'm so happy to anytime I get a chance to work with you, it is really a pleasure and an honor. We've known each other for a few years, and so when you called, I was all in. This is great.
Wonderful, wonderful. And Dr. Orsini, in addition to being a doc, I guess we should specify that you are an intensivist in the NICU here in one of the large hospitals in Orlando. But one of the reasons that I like you so much is because you are a man of many talents. You are not only a doc, but you're a podcaster, you're an author, you're a speaker, a consultant, a trainer. So I feel like we could look at so many different angles of your work. But can we maybe start a little bit at the beginning? What drew you to medicine in the first place, and how did you decide on working with babies?
Well, it's interesting. I think what drew me to medicine is it's all about our life experiences. As a child, on Christmas Day, when I was 5 years old, I actually experienced a very prolonged epileptic seizure. It's funny how your parents tell you that they used to walk to school barefoot uphill both ways, but as my father tells the story, it was Christmas Day and there was snow up to his chest, and I had an epileptic seizure. He called the ambulance and they told him, "I'm sorry, the snow's too high." And so my father likes to tell the story that he carried me above his shoulders in the chest snow 3 blocks. But here's where the story breaks down, Marcus. He says he got halfway there, and my grandfather picked him up in the car. So I said, yeah, this story doesn't really go, but I guess over the years the snow got higher and higher. But I think what happened is I spent in those days. Now it's not a big deal when you have a seizure. We treat it with medications. But I'm 57 years old, so 52 years ago, every time you had a seizure, they put you in the hospital. And so I was in and out of the hospital. And by the grace of God, I outgrew my epilepsy, so I was off medication by the time I was 13. But I think it probably, thinking back, had a real impact on me. And then our family doctor and who I think really had a big impact on me. Our family doctor was not only just a doctor, but we thought of him as a friend. And I think those two, that combination of both things, and an uncle who was in podiatry just, got me into medicine in the first place. And then, I thought I wanted to be an orthopedic surgeon. I was an athlete in high school, but then when I went to medical school, I really was drawn to the human side of medicine, and the nicest people that I knew in medicine were the pediatricians. They were all great, and I loved kids, and then so pediatrics led to more influences on my life, which was the neonatologists that I met and how smart they were and how kind they were, and that's how I ended up in the NICU. And 25 years later, I'm still, working with little tiny 1 pound babies.
Which of course is going to bring about some joyous moments and some not so joyous moments, and that's really where your work outside of a clinical setting comes in, right? Can we go to that a little bit?
Yeah, so NICU is certainly an emotional highs and lows, and I won't tell the whole story. I talk about it in my TED talk that you can go to and listen to. I give the whole story, but in a nutshell, when I was training to be a neonatologist, so I'd already finished my residency. I'm now doing my fellowship. I had the absolute pleasure and honor to work with some of the best in the country. I mean, they had their own textbooks, these neonatologists that trained me. This was at Thomas Jefferson University. They were also the nicest human beings you ever want to meet. They were so compassionate. And I've seen that. And I saw how they treated the parents. But I also saw, Marcus, that in times of difficulty, when they had to give bad news, when they had to tell a parent that their baby had brain injury or wasn't going to survive, many times they really had a lot of difficulty with with that skill, and often with good intentions, sometimes even made things worse. And so when I looked into it, I realized, well, nobody's training doctors how to do this. And so I think that really profoundly changed me and put me into the whole human side of medicine. And I spent the next 10 years of my career doing research and interviewing like hundreds of parents about the time that their life changed forever. And you and I have talked about this before. And they were very willing to tell me every detail about, when they heard the news and what worked for them, what the doctor said or did that helped, and what the doctor may have said and did help. And so I started a program in 2010 called Breaking Bad News, and that was training doctors using improvisational role playing and workshops. And here we are 12 years later and down, individually, we've trained thousands and thousands of physicians all over the country. And that just led into being a real student of just how humans communicate and get through difficult conversations. And I've used my skill and experience to train businesses around the country too. And just because, leadership has to communicate and HR has to communicate. And so I almost have two lives, but they're very intertwined.
I understand that aspect of having mixed passions that do intersect. I've listened to your TED Talk. It was wonderful, by the way.
Thank
And
you.
you tell the story of a time when you saw it done poorly, when a physician had to give information to a family that a baby had died. And that was, you said, during your residency, correct?
My fellowship. So I finished
Your
my
fellowship,
residency, and now I
okay.
had 3 more years for to be a neonatologist. So it's 6 years to become a neonatologist.
And so in all of the higher education that you did, what kind of training did you personally receive in how to communicate with patients and families?
Zero.
Yeah,
Yeah,
unfortunate, right? That's where the need comes in.
and I know this is your passion too, and things are changing a little bit thanks to people like you. But for decades and for centuries, really, doctors have learned how to communicate with patients and families through to just observing their seniors. The problem is if you're watching someone swing a bat incorrectly and then you emulate them, you're just going to start swinging it incorrectly. So I had no basis, nor does even the young residents that I teach now have no basis when they see a doctor get through any conversation, just patient experience, a routine visit. They don't have any basis to say that doctor did it well or this doctor didn't do it well because they don't even have a baseline. And so I had none, and that's why I think it just, when you're giving profound news to somebody and changing their life forever, studies have shown, as you know, you can adversely affect them for 30 years. And so even today in 2022, I think it's so absurd that we would take a young doctor who and give them a 1 hour lecture in third year medical school and maybe send them through a 15-minute role play and then let them graduate and say, oh yeah, that please go tell that mother that their baby just died. And if I said to you I was going to give you an hour lecture on how to do an appendectomy and you're going to go do one, everybody would say that's ridiculous. But to me, it's the same thing. You're changing someone's life forever. And so it's ridiculous that we don't train them. And the medical schools will now tell you they do, but it's still really, really lacking. As you know, I know you're involved in a lot of that. It needs to be a lot more.
When I was in the narrative medicine program at Columbia, we talked about how this training in humanism and active listening, it was just nil
Yeah.
in med school. And we said, it really needs to be started in med school. And then we thought, well, it really needs to be started before med school. And that's where I feel so fortunate to get to work with the pre-meds at Notre Dame, teaching them these types of skills, how to be with another person when they're suffering, and bringing in veteran doctors like yourself to talk about the things that have gone well, the things that haven't gone well, the lessons that they've learned. And especially with you doing this for so many years now, and I mean this as in the communication aspect, what are there some basics that go across not just with doctors, but with nurses, with PTs, with the other health professions? Are there common threads between the professions with communication and compassion?
Just to be clear, you're talking about during difficult times communicating with patients or communicating with each other?
Well, I guess I'm thinking about it's the doctors spend a relatively small amount of time with patients in the hospital. You probably do more in the ICU. But are there ways that you can also help nurses communicate better with patients? Are there ways that you can help physical therapists have better communication with patients?
Yeah, that's a great question. And there clearly is. In my book, I talk about a concept that I learned from my mother many years ago called "It's hard to fire your best friend." And I talk about that in the TED Talk too. And I had Stephen M. R. Covey on my podcast too for The Power of Trust. And he talks about banking trust. Trust is like money in the bank. And so the common thread when you are dealing with any patient or patient's family is that the word that I keep driving home to young and even, we're training doctors who are 20, 25 years out is relationship. That this is a relationship between you and the patient. And it's no more, is it ever more important than with nurses, right? So the nurses are at that bedside, especially in the NICU. They're not even allowed to leave the room. So they may be in a room with a mother for 8 hours, 10 hours. And so I try to teach when I give my workshops that the first step is to just build rapport, to be a person. Don't just be the nurse or the doctor. We are so trained, Marcus, about on making sure you're always professional. Make sure that you're the doctor, and the days of the white starch coat and doctors not feeling that may have worked 50 years ago. It's not what today's patient wants, and it's really not what today's patients need. You don't demand trust and honor. You get it. People give it to you, and so one of the common threads I think is first just be a person. Imagine that you're that patient. This may be your fifth patient with is a premature baby that's this week, but this mother never had a premature baby before. And so if we can relate to people on a personal level, we do little things about sharing personal information, being person. Don't just be Dr. Orsini, be Dr. Orsini who's from New Jersey, who has who likes the Yankees. And when you can do that, when you can sit with a family or a patient, spend not a long time, a minute, just being Marcus, just being Tony, and then say, hey, let's talk about your baby and let's go. Now, if it's a difficult conversation, of course you're not going to do that, but there is a process. But what I'm trying to say is it all has to do with three words: compassion, relationships, and trust. And if you can establish that, even when things don't go well, it's well known by the American Bar Association that even when there's a malpractice, when there's a medical error, people are unlikely to sue if they feel that relationship, compassion, and trust from their doctor. And so I think we have become in medicine so task oriented. And that's for a variety of reasons. You have to see more patients, the economics, you got the electronic medical records. That every day, it happens to me too, every day you got to catch yourself and say, wait a second, it's not the kidney patient in room 34. It's Susie in room 34 who happens to have kidney failure. And so that's my long-winded answer to the best advice I can give to nurses and PTs and doctors.
We talk about difficult conversations, and that's the title of your podcast too. And whenever we're talking about it right now, it sounds like we're talking about when a doc has to deliver the news that a patient has passed. But really, every conversation in healthcare with a hospitalized patient or family member is difficult, right? That's an extremely stressful time for the patient, for the family around them. It's not the same as delivering devastating news, but all those conversations need to be treated, as you said, with relationship, compassion, trust. And how? What is the best way that you can do that with being mindful of course, you've got other patients, and nurses have other patients oftentimes too. So, what's the quickest way that you think clinicians, providers can start to build those levels of trust?
Yeah, it's a great question because I get that question all the time. It's like, oh, Dr. Orsini, I'd love to sit and talk with my patient, but I have 12 patients to see today, or I have 25 patients today. But let's take what we learned from difficult conversations, okay? So, and we'll extrapolate that. So when you have a difficult conversation, if you do it correctly, and I have an acronym that I talk about in my book and in my class, it's called program. But if there's a certain process of how you deliver bad news, okay, we have demonstrated consistently that when you deliver that bad news in a proper manner, not only is it good for the patient and the family because they feel this bond to you, it's compassion, it's good for my soul because I know I did something right, but it actually takes less time because if it's like what your mother taught you, if you do it right the first time, it'll save time. It's when these conversations go wrong that now you're in this conversation, maybe become adversarial, the trust breaks down. So let's extrapolate that to your everyday conversations. If I, it's been well known, as you know from this, that when doctors sit down, the perception is that the doctor was in the room twice as long as they actually were by the patient than if the doctor stood up. And so I have demonstrated over and over again to a lot of people who are really reluctant to believe me that we can build rapport, appear that we're not in a rush, build this relationship. There was a study at the University of Florida. You can build a relationship with a patient in 56 seconds, and you can do that and still go home at the same time. And I'll give you an example. We've been trained in medicine for hundreds of years to introduce myself as one of the doctors. Hi, I'm Dr. Orsini. I'm one of the neonatologists. We did a study with a bunch of parents, and I said, here was the question. What would you prefer? A doctor coming into the room to take care of your child saying, hi, I'm one of the pediatricians, or I'm the intern who's responsible for your child today? Now, 40% of them, almost half, said they'd rather have the intern. And I said, an intern's fresh out of school. They don't know nearly as much as the pediatrician. But their comment almost universally was, that intern took responsibility for my baby. I know that he doesn't know anything. I know that she doesn't know anything. So just simple as introducing yourself as, I'm the doctor who's responsible for your care tonight, automatically builds that relationship. And there's little things that we can do. And so it doesn't have to take more time.
Ownership, as you said, it's almost ownership, and I'm taking accountability for you're mine, you're
Yeah.
mine. I often say that, of course, the two most compassionate words are "I'm here." The second two most compassionate words are "me too," and the third phrase is "I've got you."
I love
I've
that.
got you. And I feel like whenever a doc would say, "I'm your doctor," that is really it's building that relationship so quickly. I am yours. I'm here to give you the care and compassion and the medical services that you need.
And how long does that take? 3 seconds, right?
Right,
Yeah.
exactly. I understand that everybody says that they're so pressed for time that everything is about efficiency, but it doesn't take an inordinate amount of time to make a compassionate, personal connection with a patient. It takes being intentional. It takes being intentional.
It ends up saving time, Marcus, because what happens is if you're in a rush, you end up being like the gerbil on the wheel, right? You're running all over the place, you're not getting anywhere. So if I go into a room to talk to a patient, I stand up, I got one foot outside the door, and I say, hey, just want to know if you have any questions. And the patient obviously sees me and says, he's in a rush, I don't want to bother him. So now I might get out of that room 2 or 3 minutes earlier, but invariably what's going to happen is I'm going to get a call from the nurse 2 hours later saying, Mrs. Smith, she wanted to know if you were coming back because she has a question. So now I got to go back. And so efficiency, your mother was right. Do it right the first time. I can't say it enough. And you'll say, and we have one of the world's largest NICU, and we go home at a good time, and we practice everything that I teach with the Orsini Way.
Tell us a little bit more about that, because you've taken this training, not, it makes perfect sense for clinicians, but you've taken this outside of the realms of healthcare too, right?
Yeah, and it's been really amazing. And so I went for years teaching just healthcare. I gave a lecture every now and then at a business conference, but I really never gave it much thought until during COVID. I was getting calls from international companies saying my HR people are having difficult conversations with people right now. They're laying people off. They are telling Johnny that the person who was in the cubicle next to them just died. We're not prepared for these difficult conversations. And so I that's when I started realizing that the skills that we learn in medicine go right into what HR people have to do every day, what good leadership is. How many, in my podcast, I've spoken to so many different guests who will tell you, most people leave their job because they don't like their leader. They don't leave their job because of money, and that communication is something that everyone just struggles with. And so, I've been trying to. I've been doing a few more lectures, and I love to do keynote speaking. So, if you're out there and you're in the business world, let me know. But it's the angle that I talk about is, if I've learned to navigate through telling somebody that their child is going to have significant brain injury for the rest of their life, I can teach you how to be sensitive during your year-end review, and build that trust, and so that even after you give somebody a bad review or after you fire them, they leave your office saying, okay, I just got fired, but that person did it in a kind, compassionate manner, um, and then that just we've shown that this improves leadership skills, which decreases turnover and improves ROI. If a company or a healthcare hospital wants to really improve their ROI, stop your turnover. The turnover is killing you.
When you go out and talk to business leaders, are you sharing those same techniques? It's hard to have compassion if you're an HR leader who has to lay someone off, right? It's hard to do a firing or a termination with compassion. Do you find that business leaders are I don't want to say more resistant. Are they as open as doctors to this type of training?
Yeah, I think they are more and more now. Because the big companies that haven't really moved into the 2022, some of them are still, the human resources have specific words that they have to say when they fire somebody, et cetera. But the term servant leadership has been surging in the business world right now, and they're changing chief of human resource titles to chief heart officers and chief people officer, and the generation today wants that relationship. And so it's the beauty about the program acronym that I developed for Breaking Bad News is that it's essentially the same acronym that we use during routine patient interactions on how to build trust and rapport. And so the teaching that I do for healthcare executives, they they just go right into business world and human resources. And so when I'm training HR professionals, we'll go over that acronym, and it's plan, review, let's go over what happened. The O is for observe or body language. The G is for either gradual or genuine, be a genuine person. The R is for relationship. and then there's accountability and meet or next steps. And so that acronym can be used, and I don't want people to memorize it, but we use it as a roadmap. And I found that it really does go beautifully right in the business world.
We're all human, right? At the heart of everything, we're all human. What no matter what job we're doing, and we all have some of those same human needs for compassion and connection, and we're social creatures by nature. I I feel like these days too, and I'd love to get your take on this, but we are in a really difficult time in our society right now. We know that deaths by overdose and deaths of despair are through the roof. We know that there have been major turnover, especially in healthcare. A lot of upheaval in society thanks to the pandemic, not to mention a million other factors too. We need to be practicing these things with our colleagues. We need to be practicing these things with our families, not just provider to patient, right? How do you facilitate that to have good conversations between colleagues? How do we have more compassionate communication with our colleagues?
That's a great question. So again, the beauty of it is that there's just general theme, and that is an issue right now with colleagues, where either it's the leader not getting along with the team members, or we're not getting along with each other as coworkers, or we're not getting along. And something like 70% of divorces are due to poor communication. That's just crazy, right? So it is all about really those three words again. So, trust, relationships, compassion, and I'll add another one when we're talking about is rapport. Tony Robbins talks about rapport all the time. It's just finding commonality, I think he states it, is finding commonality. And you can find commonality with anybody, as you know. It doesn't matter your ethnicity, your race, where you're from. And I like to do these little exercises during some of the workshops where I'll show a room or a hospital room or someone, and I'll flash it up on a screen, maybe 5 or 10 seconds, and then say, okay, what can you talk about? And maybe there's a baseball cap in the room. Maybe the patient has um, a, a book, and we can find commonality. When you're walking through the office and you buy the water cooler, you don't find commonality by interviewing somebody, but you share personal information about yourself first, and then they'll share information. And so I can't express enough. It's building this bank of trust and this relationship, and back to that hard to fire your best friend. And when you want a team works, look at baseball, right? They say if the dugout's dysfunctional, you're done. It doesn't matter if you have all Hall of Famers. And it's the same thing in a group of business or in the hospital. If your team members get along and get to know each other on a personal level, your functionality is going to go way up, your turnover is going to go way down. And so it's all about building that personality. And sometimes you have somebody, again, I'll use another baseball analogy. Sometimes they say, oh, the team was lousy last year because we had one cancer in the dugout, who just didn't get along with everybody. And so you have to make sure that your team likes each other. Here's a great thing. You're such in the patient experience when we teach. The receptionist at your office, or let's say the emergency room. Oh, Tony Orsini comes to the emergency room. He checks in. The receptionist says the triage nurse will be here to get you in a few minutes. That's nice. But now say, my friend Jody, she's the triage nurse. She'll be out in a few minutes for you, Dr. Orsini, and she'll take good care of you. What a difference in that feeling, right? We're a team. And
Yeah.
so I think you really just have to, professionalism follows. People will respect you as your doctor, the nurse, the boss. I love the saying that say people don't follow because they're told to, they follow because they want to. And I can't express that enough.
That's a great phrase. Honestly, I've never heard that before, but that really sums things up quite well.
Yeah.
So I want to thank you so much for not only being with me today, but for the work that you do. Obviously, saving children's lives is incredibly honorable and respectable, but the fact that you're doing it in such a humanistic, compassionate way and sharing that information with docs who, like you said, have not had any training in this. It's leaving such a good mark on this very dysfunctional world of healthcare that we now find ourselves in. So, thank you for doing that work.
Thank you so much. And I'd like to just add one thing. This compassionate medicine that we do as doctors, nurses, physical therapists, it's also a selfish thing. And let me tell you why. Because physician burnout right now is so high. But when you take that time and stop being task oriented, and you're able to bond with your families and your patients and really interact with them. I mean, running a code blue, be honest with you, we do it all the time. Okay, it's routine for us. Okay, it's not. I don't want to minimize it, but it's just part of the job. But when you are able to stop yourself being task oriented and you enjoy the relationships, whether it's 10 or 12, 15 patients that you saw that day, when you drive home as the nurse or the doctor, you're going to feel really good about yourself. And that's going to fill your soul. It's going to avoid burnout. And so I give a lecture called What They Want, We Need. It's the same thing. They're dying for this patient experience. But if you really do it right and build those relationships, it's going to fill your soul. You're going to come home and you're going to feel great. I do CPR all the time. I come home, okay, I did it again. I'm not minimizing that. I'm very proud of that. But filling your soul knowing that you comforted a mother at a difficult time, or you made a couple of good relationships in with maybe you bonded with the nurse or a physical therapist or a coworker in business. It's gonna so do it for selfish reasons if you're not going to do it for any other reason.
There's nothing wrong with that. I'm so glad that there are quote unquote selfish people out there that are doing this work. There's nothing wrong with the desire to help humanity. I think that's a very noble cause. So, in the time we have left, in the interest of what you just referred to, of building rapport, can I shoot some rapid fire questions past you that have nothing to do
Oh boy.
with communication and such like that?
All right, here we go. It's like inside
All
the actor
right,
studio. I used to watch that
there
show
you
all the
go.
time.
Well, I ask you this. So let's say that you are stranded on the proverbial desert island. You've got all your food, you've got all your nutrition and housing and such like that, but you can only have one piece of art with you, whether that's a book, a film, a piece of visual art, maybe a Broadway production. What is a piece of art, or another way to ask that question is what is this piece of art that really speaks to you?
I'm on a deserted island. Is that the
Yeah, yeah, you get one piece of art on your deserted island.
I don't. God, that's a tough one. I don't really know. The gross anatomy one comes to mind. The big painting of the gross anatomy. I'm trying to remember. I'm drawing a blank on the artist. But I would look through that every day when I went through the halls of Thomas Jefferson University. It was in there, and I'm embarrassed to say I forgot the name of it. But that piece of art is famous and it's just beautiful. I'm a water person like you would not believe. So my answer was going to be any piece of art that shows water and a boat. But if I'm on a deserted island, I guess I don't need that. Yeah.
You've got the view right out your back
So
door.
yeah, I don't know. That's a tough one. So.
Good. All right. Well, so second question for you is let's say that you opened up your wallet and you found that a $100 bill had magically appeared in there and you have to spend this today, but you have to spend this money on yourself. What is the $100 gift that you buy yourself or experience?
It would definitely be in the area of water, possibly going fishing or going on a boat trip or something like that. That's my true love. I'm a water person.
Awesome, awesome. And then the last question for you, and I may have even stolen this question from you. I can't remember. I know at some point in the last couple of years I was on a podcast and I got asked this question, and I straight up stole it from the host. But if you had the world's largest billboard on top of the highest mountain, what is your message to humanity?
It's something that I say once, twice, 10 times a day. It's the philosophy of my life and the philosophy of my communication. And that billboard would say, which is the title of my book, it's all in the delivery, because it says so much. It's like, it's not what you say, it's how you say it. It's how you provide the care. It's how you provide compassion and relationships with your family members, with your wife. And so that is the philosophy of my life. And I would say it's all this big billboard would say it's all in the delivery.
Excellent. And we will put a link to your podcast, your the Orsini Way. We'll put it all in the show notes. So I hope that other people, other hospitals, other facilities, systems, businesses will take advantage of the years of research and experience that you have, and also tap into your podcast, Difficult Conversations. Great stuff that you have on there for ongoing education for clinicians. And I really appreciate what you're doing in this space. It's good to call you a colleague in the work of compassion. And I just can't thank you enough for being with me today.
Well, thank you. It was an honor and a pleasure. And yes, if you do go to my podcast, I think you were the third guest, so you were top on my list. And it was an excellent episode. I've been a fan of yours for a while, and I hope that we get to continue to work together, maybe do a couple speaking and speak to some students, et cetera, together, because I have your books right over my shoulder, and I'm a big fan. So this is an honor. Whenever you call, I will be there, my friend.
I appreciate that. Thank you so much, Dr. Orsini.
Take care.
And everyone else, thank you for tuning into this episode of Compassion and Courage, Conversations in Healthcare. Again, thank you to everyone for rating, reviewing, subscribing, sharing, doing all of those social media interaction things to help us keep the word about compassionate communication alive. Thank you all so much for being with me on this episode of Compassion and Courage.